Okay, the second half of our project is on chromium picolinate. The website engine utilized were Google.com, which gave us 1,490,000 results, and the Gamecock Power Search, which gave us 1,906 results. What is chromium picolinate? It is a nutritional supplement that works to increase the efficiency of insulin to optimal levels, a combination of chromium and picolinic acid. It has been newly seen as a miracle mineral. It has been advertised to do many things such as aid in weight loss, mood enhancement, help with depression and other mood disorders, promote energy, increase your lifespan, prevent acne, lower your blood sugar in people with type 2 diabetes, increase blood sugar in people with hypoglycemia, which is low blood sugar, treat polycystic ovarian syndrome, and help in athletic training such as bodybuilding. Common uses for chromium picolinate. Most commonly used as a weight loss aid because it claims it can melt fat, drastically reduce appetite, increase metabolism, and recent studies have claimed that they are a safe alternative to steroids because it increases strength and lean muscle mass. A common ingredient in many herbal weight loss concoctions, and it is a nutritional supplement, not a prescription drug. Why do people use it? Most of the claims about the frequency of chromium deficiencies are based on dietary intake of chromium. Even though some studies show that Americans actually get enough, studies have shown that the body will compensate for chromium absorption. It is difficult to diagnose a deficiency because it's found in many things like grains such as brewer's yeast, wheat germ, and whole grains, vegetables like mushrooms, green peppers, spinach, broccoli, potatoes, and green beans, fruits like apples and bananas, proteins like beef and poultry, milk and dairy products, and other things like black pepper, butter, and molasses are also good sources. Chromium doesn't really have an RDI level because it's stored in the blood and hair, but the Food and Nutrition Board at the Institute of Medicine recommends the following dietary intake for chromium, and you see those numbers there. So it varies for age. And then on the right it shows just a regular, or just a sample of chromium that can be found in certain foods. The credible website we found, it was for NCAM, which is the National Center for Complementary and Alternative Medicine. So we've heard of that in class. But 63 people aged 18 to 75 were randomly assigned to receive either 500 microgram capsule of chromium picolinate or a placebo drug. And this was twice a day for 16 weeks. The researchers looked primarily for improvement in insulin sensitivity and other changes in glucose metabolism, like insulin secretion, oxidative stress, fasting lipid serums, body weight, and inflammation markers. The results showed a single-dose study, from the single-dose study, showed that chromium picolinate had no effect on insulin sensitivity or other key features of metabolic syndrome. However, it did appear to increase the early phase of insulin secretion in response to glucose. The researchers concluded that their study did not support the use of chromium picolinate as a treatment for people with metabolic syndrome. Instead, they recommended they rely on diet and exercise. And the picture on the right shows how you're supposed to, like your diet, if it's better, you don't have to expend as much energy as you would if you had a really crappy diet. The dubious website showed instructions on how the chromium picolinate for weight loss could be utilized. They included taking the supplement along with diet, exercise, and living a healthy lifestyle. They warn that too much can be harmful and that recent studies show it could present health risks. The scientific publication showed metabolic syndrome is a strong predictor of cardiovascular disease as well as type 2 diabetes. Prevalence of this disease varies widely among many countries, but it represents a significant global public health problem. Increasing interest to develop safe, effective, and cheap nutritional interventions. The most studied and widely used supplements are cinnamon and chromium. The beneficial evidence of effects of these supplements on glucose levels, insulin resistance, and their other lipid profile in people with elements of the metabolic syndrome. Review of the study. In chromium, earlier studies showed improvement in the first 2 weeks of supplementation. This happens because of process, which is blood bound to carrier protein that binds to receptor on cell membrane that results in an increase in insulin sensitivity and is consistent with previous findings of increased GLUT4 translocation in muscle tissue of animal models treated with chromium. And cinnamon was used by harvesting, and they used the shoots that were stripped from bark, which was then left to dry and ground to what is known as cinnamon powder. In recent years, the bioactive compound of aqueous cinnamon extract has been isolated. This compound has insulin-like activity, antioxidant effects, and antimicrobial properties. The exact mechanism of action is not clear, but strong evidence suggests that cinnamon extract increases autophosphorylation, leading to activation of the insulin receptor and decreases in the activity of an enzyme that blunts insulin action. In vivo models, no change is observed in number or size of adipocytes in animal models, suggests that cinnamon extract may exhibit its beneficial effects to improve insulin resistance without promoting weight gain. The results showed that emerging clinical data indicate beneficial effects of cinnamon extract on insulin sensitivity and glucose levels in people with type 2 diabetes, as well as healthy subjects. However, very little evidence is shown for people with metabolic syndrome. Randomized controlled trial that subjects with type 2 diabetes ingested 1, 3, or 6 grams of cinnamon per day. After 40 days of cinnamon intake, fasting serum glucose level and the lipid profile were significantly improved even 20 days after treatment. The effects were sustained. Although cinnamon extract seems to be effective in lowering FPG and HPA, more randomized clinical trials are needed to affirm these results and determine the mechanism of action. And that's our bibliography. Thank you.